for this evening, Miss Carol. This is, can you please verify your name and date of birth? Very good. 9/13/1985. Excellent, Miss Carol. So I am going to provide you wound care, okay? And I need to collect a culture. All right, so I'm going to wash my hands and provide the patiency, good old privacy. And I'm going to identify again, can you, birthday, name, and date of birth, perfect. And provide environmental check, no trip hazards, fire hazards, oxygen is all right, okay. I'm going to adjust the bed to my comfortable work height, and last but not least, gather my supplies. I have my handy dandy pocket nurse dressing tray with instruments and abdominal pad for the wound situation, and irrigation tray with piston syringe, and here's my dandy water. It came with my duffel bag, okay. And these are my supplies, and I'm going to verify the order for the by the MD. And also, I gave you pain medication about 30 minutes ago. Yes, at 0500. What is it? 1700. Yes. And how is that pain, Miss Smith? Is it any better? Worse? Okay, I'm glad. Okay, so now sometimes if you are experiencing pain in that area, because you mentioned it hurt last time, you got a dressing change. So we went ahead and got the order for the doctor to give you medication prior to the dressing change and all that. So pain is 2 out of 10, right? From about 8 out of 10 from 30 minutes ago. Excellent. Excellent. So we're good. So now that we are going to do this, we're going to change the dressing, and we're also going to examine how well your wound is healing. That's why we do this. And also we need to collect the culture to make sure that there is, or if you are having an infection, what is causing it, okay? And then, so we already know medication went well. Here's my supplies, blah, 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 blah. Okay, I'm going to expose the patient. I don't know if you can see that. She has the prettiest gown, my patient. Oh, okay, so we've done that. Okay, so I'm going to place you in a comfortable position. Let me know how comfortable or uncomfortable are you, okay? And then now, let's see here. We're going to take a look at this. I'm going to put on some clean gloves. Okay, clean gloves. Okay, patient's position. Wash my hands at the beginning. These gloves are no good. So now I'm going out. I've washed my hands a second time. I'm putting clean gloves. And I'm going to remove the old dressing, right? I removed the old dressing. Okay, Miss Smith, I need to go a little flatter, okay? Just tell me how uncomfortable you get, okay? That's why we gave you those pain medications earlier, okay? So we need to, we're going to assess the wound. We're going to, we're going to remove the old dressing, including the packaging. And we're going to note the color, the odor, the consistency, and how much comes out of the wound. So I'm going to remove, okay, we've got outside dressing, okay, and we've got some packing in here. Perfect. All right, so now that I've removed all that, I'm going to assess the wound bed, and I'm going to check for, oops, I want to keep the wound exposed. I'm going to, now that I've done the, let's see, I'm looking for the color, I'm looking for odor, I'm looking for amount, I'm looking for what is it, if there's anything coming out of the wound. Then I'm going to look for the edges of the wound. What do we have? We're looking for tissue exudate, any induration. So for the induration, I need to use my little stick here and use the clock to measure if there's any induration, which is where there's a gap that goes under this way, underneath the skin of the wound. Okay, I do not note any induration here. And then what else? We're looking for eschar, slough, anything like that. None of that stuff. I don't see any slough. I don't see any eschar. So she looks to me like she's healing really well. There might be a little bit of swelling, a little bit of swelling at 3 o'clock, but that's about it. No swelling. Okay, and then we're going to measure the wound. Okay, we're going to measure the wound. So we're going to take out our little thing here. Okay, we use this and we're going to measure we're going to probe with this along the edges of the wound. I know you can't see here edges. She doesn't have a real wound, but we're going to go like that. And then we're going to measure like that, like this, you know, like this, like that. Probe for induration, and that. She had a little bit of swelling at 3 o'clock. Then I'm going to check for the deafness, and then I'm going to measure how deep it is. And so that wound is about 2 centimeters deep, okay? And that's how we chart. So once we do that, once I measure and do everything, and I'm going to remove my gloves, okay? Yes. All right, so I've already measured. Measure, dev, swab, everything, okay? Now I'm going to irrigate the wound, but for that, I am going to use gauze pads, and I'm going to, that's the pads to catch any of that stuff. Ow. Ow. Dang it. I know I need to use these gloves, but this video is going to take forever if I try to save them. Okay, all right. So now that I've done that, I'm going to put on another set of clean gloves. I don't know why I did that, but I'm going to irrigate. Going to use the, what are my wound pads? Okay, I'm using wound pads here to catch the irrigation, but then I'm going to use my handy dandy. I got clean gloves on, my gloves ripped. Oh, another pair here. Okay. Jesus, this is not good. Okay, my gauze is needed, and I'm going to irrigate with normal saline, just what the doctor ordered. Okay, yum, yum. There's no gauze there. So we got normal saline in here. Take it out, and we put the gauze there, right? And we have a chuck underneath in the normal scenario in a perfect world. And I'm going to irrigate. I'm going to irrigate all sides, you know, especially if you know you have induration, you know. And then I'm going to irrigate. And I've got my gauze and the chuck underneath, which are catching everything, right? Yes, right? And everything. All right, now, after I've irrigated, I'm going to remove that. Okay. to, okay, perfect. Now I'm going to, once I've irrigated, oh my God. These gloves, okay, anyways, I've irrigated and everything, and I've got clean gloves and everything on. I'm going to collect my culture after irrigation. I'm collecting my culture. Do I have a thing here in my little handy dandy? Do I have a... No? Well, this would be the time where I would be collecting the culture. So I would take it from the swab and I would take a sample, put it in there, done, send it out, okay? Again, remove gloves, wash my hands. And now I'm going to discard everything and I'm going to set up my sterile field so that I can do a sterile dressing, okay? So now that I've done all that, I'm going to prepare which I have my kit here, okay, now I've got all my clean gloves and everything. I've collected my culture, wash my hands, bam, 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 bam. Okay, got my sterile gloves again, okay. So now I'm going to done my gloves again. Okay, going to, I know, okay, it's just, anyway, so now I'm going to drape the patient. Now that I've gotten my sculpture and everything, alrighty, do not cross-contaminate, yes, I know. So now I got my sterile gloves on. Honestly, okay, down keeps coming down. I took everything down, so I'm going to use this. And so we removed some packing earlier. So we're going to put the packing, oh, here's another pair of gloves. We're going to put some packing back in, noting how much we removed. So we're going to put the packing back in. All right. I'm going to put the packing back in. We've irrigated packing and everything. Okay. We did the packing. Then we put abdominal padding. Okay, we have some tape on the side. We're all good. Okay. Cover the patient. Discard anything in the bio that has been touched with bodily fluids. And we're going to ensure safety again and evaluate how the patient feels. And Ms. Smith appears to be comfortable and smiling. We're going to lower the bed to the lowest position, breaks, do a safety environment. How you feeling, Ms. Smith? Really good. Medication, pain medication still working? Whew, okay, very good. Here's your call light. Side rolls up. Let me know if you need anything.